are the best. And there he is, Dr. Selene Parekh. Hello, Doc. Good morning.
What's up, guys? Loving the show.
Thanks, pal. Appreciate it, Doc. You know what's funny? Can I just say this before we get into it? The Rothman doctors have such great bedside manner. Like, I look at your face, I go, that's a kind face, right? Like, I know I'm in good care. I go, like, Dr. Parekh, I go, all right, like, look at him, like, I'm good. Like, thank you, because you guys do God's work, man.
I appreciate it. Thank you.
It's a big deal. All right, so listen, Jalen Carter's heel. Now, we know that you are not his doctor, so, this is kind of in theory that we're talking about this. When a player is listed with a heel injury, what's the most common possibilities behind that label?
Yeah, so when you think about the heel bone, it is the bone that strikes when you walk, right? It's right at the bottom. And so when we talk about heel pain in the athlete, they typically have one of two things going on. Either they have a bone bruise, and that's causing pain on the inside of the bone, or they can have something called plantar fasciitis, which is inflammation of the tissue that lays right on top of that bone. Yeah, that can be a bad one.
Oh, it feels like you're walking on nails.
Yes.
You have experience.
Yes. Yes, Doc. Oh, it's the worst. I thought they were called, I thought it was shin splints, right? Isn't that like the layman's term?
The shin splints are up by your leg bone, right?
Right.
Right in front of your shin. A lot of our runners get that, or some of the basketball players get that.
And between that and those, the plantar fascia, oh, God, man. Oh, just thinking about it, walking, it's like, no pain. How serious for, we're looking at a big man, right? A defensive lineman, when it comes to the heel, how important is that?
Well, it's very important, right? Because every single step you take, every time you cut, every time you explode out of the line, you're putting a lot of pressure on that heel. So unless that's quieted down to the point where he can play effectively, although rumor has it that he's playing this week.
Yes,
that's gonna affect your play.
Yeah, and you wonder is how long can you go with that? Like, is that something that you can mask the pain? Is it something that several snaps? It will. You expect a guy, not Jalen, but a guy be limited with that sort of injury?
So it all depends on the severity and what exactly it is, right? So if it's a bone bruise, you can pad up his cleat as best you can. But the problem is every time you pound on that heel, every time you explode out, you're putting a lot of tension and pressure on that bone. So you're really limited. If it's plantar fasciitis, yes, you can give him some steroids to calm it down. You can actually give him some numbing medications to calm it down. PRP, stem cells. You can do a bunch of different things to try to accelerate how fast it heals. And a lot of guys can play through plantar fasciitis. The bone bruise one, that's a little tougher to play through.
So in either situation, either diagnosis, what is the recovery kind of period of it? And obviously we know severity is a key component.
Yeah. So severity is very key, especially when you're dealing with plantar fasciitis, right? Peyton Manning had been shut down for weeks because he had a plantar fasciitis issue that then led to a plantar fascial rupture where it tore, and then that can take you out of the game for weeks. So if it's a mild plantar fasciitis, you can medicate them with injections. You can nurse them through games, and that's not as big of a deal. A stress fracture also depends on severity. When it's mild, anti-inflammatories, you can do vitamin D to try to get him to recover faster. And then during the off days, you shut them down and you really protect that heel. If it's a severe stress fracture, then that can lead to multiple weeks lost in the season.
Doc, this game is going to be in a dome. It's going to be on turf. Let's talk about turf versus grass when it comes to the heel.
Yeah, well, a lot of athletes over the last few years have raised the alarm about playing on turf because of the increased injury risk they feel. And part of it's real, right? If you look at natural grass versus turf, turf is a lot stiffer. it doesn't give on the cleats once they land in the cleats. And because you don't get that give, you put your lower extremity at increased risk of injury from the knee to the hip to even the ankle. So that's a real concern. Also, because it's stiff and doesn't have a lot of give, right? That substrate underneath the artificial turf is just a lot more dense than dirt. Every time you pound on it, it can hurt a lot more. So when you have heel pain and you're playing on turf, that could make it a little bit more severe, a little bit more symptomatic for you as you go through the game.
Doc, you're amazing, man. Because you take your amazing knowledge of the body, apply it to sports, and I can listen to you talk all day, but I just break it all down. You're obviously a big fan too. Like I can tell you know sports.
I used to do all these injury insights for the last decade, so I love this thing. I breathe it, live it. I look at return to play, return to sports, looking at fantasy metrics to see when can we predict these guys get back.
Oh, that's awesome, man!
Doc rules. Doc rules.
Oh my God, we got to have a regular segment with you, man.
Yeah.
Like you do all sports too?
All sports, including cricket.
Oh, that's
awesome.
Yes, we got to do a segment with you. You, Dr. Parekh, you're awesome, man. I totally dig it, man. It's great. All you Rothman guys are great, but you got to do this. This is perfect. It'll help. We have a fantasy geek, so now we need a fantasy doctor. So you're the man, pal. Thanks, Doc. You have a great weekend, buddy.
Thanks, guys.
Really enjoyed it. We got to do that segment.
Thanks, guys.
How about Doc?